Question 1. A TB patient refuses to wear a surgical mask during transport. What is the nurse's best response? A. Cancel the transport. B. Proceed without mask to avoid confrontation. C. Delay transport and re-educate patient. D. Ask the transporter to wear a mask instead. Answer. C. Delay transport and re-educate patient. Question 2. Which finding would prompt the nurse to suspect multi-drug-resistant TB, MDR-TB? A. Patient reports no symptoms after 3 days. B. Patient fails to improve after 2 months of treatment. C. Negative sputum culture at start of therapy. D. Positive skin test with 5 millimeters in duration. Answer. B. Patient fails to improve after 2 months of treatment. Question 3. A patient on TB therapy develops yellow skin and scara. What is the most likely cause? A. Malnutrition. B. Normal drug side effect. C. Liver toxicity from medication. D. Anemia. Answer. C. Liver toxicity from medication. Question 4. What should the nurse emphasize to a patient with latent TB infection, LTBI? A. You must avoid all contact with others. B. You need immediate hospitalization. C. Treatment reduces risk of developing active TB. D. No medication is needed if you feel well. Answer. C. Treatment reduces risk of developing active TB. Question 5. What is the expected duration of TB treatment for drug-sensitive active TB? A. 2 weeks. B. 1 month. C. 6 to 9 months. D. 12 to 18 months. Answer. C. 6 to 9 months. Question 6. What should the nurse assess before giving streptomycin for TB? A. Vision, acuity. B. Hearing function. C. Serum glucose. D. GI motility. Answer. B. Hearing function. Question 7. Which patient is least likely to need TB testing? A. Homeless individual. B. Healthcare worker. C. Person who traveled to rural Asia. D. College student with no known exposure. Answer. D. College student with no known exposure. Question 8. Which outcome indicates successful TB treatment? A. Negative sputum cultures. B. Improved appetite. C. Patient gains weight. D. Resolution of cough. Answer. A. Negative sputum cultures. Question 9. Why is TB more common in immunocompromised individuals? A. Their lungs are smaller. B. They are less active. C. Their immune system can't contain latent TB. D. They breathe more deeply. Answer. C. Their immune system can't contain latent TB. Question 10. A TB patient's partner asks if they also need testing. What is the appropriate response? A. Testing isn't necessary unless symptoms appear. B. Only close relatives need testing. C. Yes, all household contacts should be tested. D. We can wait until treatment is completed. Answer. C. Yes, all household contacts should be tested. Question 11. The nurse finds a new graduate wearing only gloves while entering a TB room. What is the appropriate action? A. Provide an N95 mask and re-educate. B. Ignore if no procedures are being performed. C. Report the incident to infection control. D. Give a surgical mask instead. Answer. A. Provide an N95 mask and re-educate. Question 12. Which condition is a contraindication to isoniazid therapy? A. Anemia. B. Liver disease. C. Hypertension. D. Diabetes. Answer. B. Liver disease. Question 13. Which priority teaching should be included for a TB patient going home on multiple meds? A. You can stop taking them once your symptoms resolve. B. Take all your meds as prescribed, even if you feel better. C. Take all meds at night to reduce side effects. D. You'll only need to take them on weekends. Answer: B. Take all your meds as prescribed, even if you feel better. Question 14. When evaluating a TB skin test in a patient with HIV, which in duration is considered positive? A. 3 millimeters. B. 5 millimeters. C. 8 millimeters. D. 10 millimeters. Answer: B. 5 millimeters. Question 15. What is the main goal of isolation precautions in a TB patient? A. Comfort the patient. B. Reduce patient movement. C. Prevent transmission to others. D. Make room cleaning easier. Answer: C. Prevent transmission to others. Question 16. Which instruction is most important when giving TB meds to a patient also taking warfarin? A. Report unusual bleeding or bruising. B. Avoid leafy green vegetables. C. Increase vitamin C intake. D. Stop warfarin temporarily. Answer: A. Report unusual bleeding or bruising. Question 17. The nurse is preparing discharge education for a TB patient. What must be included? A. You may return to work immediately. B. Use a separate bathroom at all times. C. Follow up regularly and take meds until complete. D. Avoid family contact until medication is finished. Answer: C. Follow up regularly and take meds until complete. Question 18. Which behavior indicates a TB patient understands transmission precautions? A. Uses tissues and disposes of them properly. B. Refuses to wear a mask when coughing. C. Stays in bed all day. D. Opens windows in winter. Answer: A. Uses tissues and disposes of them properly. Question 19. Which statement shows the nurse needs more education about TB? A. I must wear gloves and gown in all TB rooms. B. N95 mask is essential before entry. C. TB is spread through airborne particles. D. Proper hand hygiene is crucial. Answer: A. I must wear gloves and gown in all TB rooms. Question 20. Why is it important to take TB meds exactly as prescribed? A. To reduce the need for follow-up visits. B. To improve sleep. C. To prevent medication interactions. D. To prevent resistance and treatment failure. Answer: D. To prevent resistance and treatment failure. Question 21. What is the best action for a nurse to take when a TB patient is non-adherent to directly observed therapy (DOT)? A. Document non-adherence and continue care. B. Instruct the patient to self-administer medication. C. Notify the public health department. D. Ask the physician to discontinue treatment. Answer: C. Notify the public health department. Question 22. Which condition would most warrant immediate TB testing? A. Sore throat for 2 days. B. Productive cough lasting 3 weeks. C. History of asthma. D. Seasonal allergies. Answer: B. Productive cough lasting 3 weeks. Question 23. What is the best strategy to ensure medication adherence in a homeless TB patient? A. Instruct to visit clinic weekly. B. Educate on importance of hygiene. C. Initiate directly observed therapy (DOT). D. Prescribe medication for home use. Answer: C. Initiate directly observed therapy (DOT). Question 24. Which symptom requires immediate follow-up in a patient on TB medications? A. Decreased appetite. B. Fatigue. C. Jaundice. D. Weight loss. Answer: C. Jaundice. Question 25. Which task is safe to delegate to a nursing assistant when caring for a TB patient? A. Administer TB medications. B. Teach cough hygiene. C. Record vital signs. D. Monitor side effects of medications. Answer: C. Record vital signs. Question 26. A TB patient is being discharged. Which instruction is most appropriate? A. Stop medication once symptoms disappear. B. You no longer need to isolate at home. C. Continue treatment for at least 6 months. D. Return to clinic only if symptoms worsen. Answer: C. Continue treatment for at least 6 months. Question 27. Which sign indicates TB infection in a chest X-ray? A. Pleural effusion. B. Patchy infiltrates in upper lobes. C. Bilateral lung consolidation. D. Enlarged cardiac silhouette. Answer: B. Patchy infiltrates in upper lobes. Question 28. A TB patient complains of tingling in fingers while on isoniazid. What is the best response? A. This is a common and harmless effect. B. We may need to stop the medication immediately. C. This may require pyridoxine supplementation. D. Avoid caffeine and monitor the sensation. Answer: C. This may require pyridoxine supplementation. Question 29. Which PPE is essential for visitors of a hospitalized TB patient? A. Surgical gown. B. Face shield. C. Surgical mask. D. N95 respirator. Answer: D. N95 respirator. Question 30. What instruction should a nurse give a TB patient starting rifampin? A. Avoid dairy while on this medication. B. Your urine and sweat may turn orange. C. Take the medication with food for better effect. D. You can stop the drug if side effects occur. Answer: B. Your urine and sweat may turn orange. Question 31. When does a TB patient become non-infectious after starting treatment? A. After 1 dose of antibiotics. B. After 2 weeks of proper therapy. C. Immediately if asymptomatic. D. Once the cough resolves. Answer: B. After 2 weeks of proper therapy. Question 32. What should the nurse prioritize for a TB patient in the emergency department? A. Insert 4 access. B. Initiate airborne precautions. C. Notify the hospital administrator. D. Start 4 antibiotics. Answer: B. Initiate airborne precautions. Question 33. A TB patient begins to exhibit signs of confusion and unsteady gait. What should the nurse suspect? A. Medication overdose. B. Neurotoxicity from isoniazid. C. Anxiety. D. TB progression to lungs. Answer: B. Neurotoxicity from isoniazid. Question 34. What is the most accurate method to confirm TB diagnosis? A. Skin test. B. Chest X-ray. C. Sputum culture. D. Physical examination. Answer: C. Sputum culture. Question 35. A patient with latent TB asks if they can transmit TB to others. What is the nurse's best response? A. Only through close contact. B. Yes, during coughing or sneezing. C. No, latent TB is not contagious. D. Yes, if your skin test is positive. Answer: C. No, latent TB is not contagious. Question 36. What is the rationale behind multiple medications in TB therapy? A. Reduce cost of treatment. B. Cover multiple organ systems. C. Prevent resistance and ensure efficacy. D. Speed up symptom relief. Answer: C. Prevent resistance and ensure efficacy. Question 37. The TB skin test is read at what time frame for accurate results? A. 12 to 24 hours. B. 24 to 36 hours. C. 48 to 72 hours. D. 72 to 96 hours. Answer: C. 48 to 72 hours. Question 38. What is a common cause of non-adherence to TB treatment in older adults? A. Language barrier. B. Complex medication regimen. C. Lack of symptoms. D. Poor hygiene. Answer: B. Complex medication regimen. Question 39. Which symptom would be most concerning in a TB patient after 3 months of therapy? A. Dry cough. B. Night sweats. C. Weight gain. D. Clear sputum. Answer: B. Night sweats. Question 40. In TB patient teaching, which statement indicates a need for further education? A. I will cover my mouth when coughing. B. I should avoid sharing utensils. C. I can stop my medications when I feel better. D. I need to follow up with my provider regularly. Answer: C. I can stop my medications when I feel better. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.